if you are planning on breastfeeding your baby, can you also use a dummy to reduce the chance of sudden infant death syndrome further? Hi, I'm Angie. I've been a practicing midwife for over 13 years. I'm a registered health visitor as well and also a breastfeeding peer supporter, and you can hit the follow button for more pregnancy, birth and parenting information. So the short answer is absolutely yes, you can use a dummy or a pacifier or a soother, whatever you're going to call it, alongside breastfeeding. And all of this systematic research highlights that there is no impact on the duration, so that's the length of time that someone decides to breastfeed for whenever they introduce a dummy or soother. However, I am going to caveat that by saying that if you are introducing a dummy or a soother from birth, it can interfere with the feeding cues that babies make. Whilst the research shows no impact on the length or duration of breastfeeding with using a dummy or soother, it's really important to note that breastfeeding works on demand and supply. So basically, the more that your baby goes to the breast in the first 4 to 6 weeks, the more milk you will produce. Therefore, the more stable the breastfeeding journey will be overall, the less likely to need to supplement at some stage, and also the less impact there is psychologically of thinking, do I have enough milk? And so the recommendation around dummies, if you are using them from birth, is only to use them for sleep time and not to miss those feeding cues. The feeding cues that babies will make will be opening their mouth, looking around, rooting for breast, sucking on their tongue, sucking on their thumb and finger. Crying is always the last resort for a baby to tell you that they are hungry. And so this is part of the reason why most healthcare professionals will recommend waiting until breastfeeding has established before starting to introduce a soother or dummy. And the reason they recommend waiting, if it's at all possible, is so that it doesn't interfere with that demand and supply and those feeding cues that babies make. And the reason that pacifiers and dummies were not recommended previously is because there was a theory that by giving a dummy or soother or pacifier, it could interfere with the breastfeeding itself. Now, all of the research highlights that this is no longer the case. On an individual experience level though, I have come across a couple of babies that started clicking when they went back to the breast after introducing soothers. And the way that that was rectified is by discontinuing the dummy or soother use on a really individual level. And that was just a really individual aspect, and there was a full feeding assessment that happened on a one-to-one basis with those babies, and also some suggestion for some cranial osteopathy as well. In these cases, the parents, after having that break, went back to the soother and pacifier just a few weeks later, and there was no clicking, there was no air intake, and the feeding was absolutely fine, no concerns. Now, the World Health Organization updated all their guidelines in 2018. Dummies and soothers and pacifiers are no longer a big no-no, and the World Health Organization now actually advised that healthcare professionals should have a balanced discussion on the use of dummies, soothers and pacifiers because of all the research of the improvements and outcomes in preterm babies by using dummies much earlier, but also because of the reduction in sudden infant death syndrome. So if you're planning on using dummies with breastfeeding, have a conversation with your midwife and get as much support as you possibly can. The main take-home points are that yes, you can use a dummy soother pacifier with breastfeeding, that's absolutely fine. Ideally waiting until your milk supply is established before introducing, and if you're using it sooner, then make sure you're not missing those feeding cues.